Hello and welcome to the 2020 Open Enrollment Employee Presentation. My name is Melanie Denning and we appreciate you taking the time to attend today. You should have received a postcard detailing the time and dates of the Open Enrollment webinars and how to access this recorded presentation. 3 live employee webinars will be held Tuesday, October 22nd at 10 a.m., Wednesday the 23rd at 1 p.m., and Thursday, October 24th at 9 a.m. As an alternative to attending a live webcast, employees may view the recorded presentation on the HCBD website at www.benefits.mt.gov/open enrollment. Employee open enrollment booklets were mailed the week of October 14th. The open enrollment booklet is also available on the HCBD website at www.benefits.mt.gov/open enrollment. Open enrollment will be held this year from October 27th through November 9th. Employees who wish to make their changes to their state plan benefits, including enrolling or re-enrolling in flexible spending accounts or on the Vision hardware plan, must complete their open enrollment elections by November 9th. You will do so online this year using HCBD's benefits enrollment system. More information will be provided in the next few slides. Before we get into the open enrollment details, we wanted to provide some reminders regarding the State of Montana Benefit Plan, or State Plan. The State Plan is self-funded and is funded by monthly employer, employee, legislator, and retiree contributions. The contributions are held by the State Plan and then used to pay state plan expenses, the vast majority of which are claims for services incurred by members for medical, prescription, and dental needs. When you balance our income with our expenses, you get the State Plan Reserve. In 2016, transparent pricing, which is also known as reference-based pricing, was implemented, and it allowed the state plan to control the cost of health care while maintaining quality, predictability, and fairness. We call this new way of reimbursing providers transparent pricing. This reimbursement model is still in effect today and continues to provide savings and has helped maintain predictability and fairness. In 2017, Navitus became the state plan's pharmacy benefit manager. Navitus allows for a full pass-through transparent pricing model that ensures that the state plan receives all rebates and reimburses pharmacies the exact amount paid by the state plan. The state plan continues to see prescription trend or expense decrease, and this program is still providing value to the state plan and its members. State plan reserves are needed because we can't control all of the variables surrounding operating the state plan. We can control many of our plan costs, but there are some things we don't have direct control over, including our largest income source, the employer contribution. The employer contribution is set by the legislature every 2 years, and HCBD provides funding recommendations. But ultimately, we must comply with the funding that is set by the legislature. The employer contribution has not changed in 3 years and will not change in 2020. Federal mandates also directly impact state plan expenses. For example, in 2018, the state plan was required to cover statins, which are cholesterol-lowering medications, at a $0 copay due to the Affordable Health Care Act, or ACA. In addition, due to recent changes to mental health parity regulations, the state plan has enhanced some of the coverages available for behavioral health and addiction treatment services. HCBD works hard to estimate and evaluate expenses so that we have a general idea of volume of claims each year, but there can be surprises. Medical trend, which is the increasing cost of medical care, is a huge variable that the state plan has little control over, and it can be difficult to predict. The cost of medical procedures and prescription medications continues to rise year after year. The state plan needs to always have enough money in reserves to cover all 30,000 plus members when they need us. As noted in the previous slide, HCBD is progressive and working hard to develop and implement cost-saving strategies to keep the employer, the employee, the legislator, and retiree contributions stable. The combination of all cost-saving actions such as transparent pricing, the Navitus PBM, the Medication Therapy Management Program, as well as increased efficiencies at the Montana Health Centers, streamlined communications, and reduced HCBD staffing has all allowed HCBD to minimize the financial impacts to all state plan members over the last few years. While progress has been made and the money has been saved, now that we are more than 3 years into transparent pricing with the hospitals, HCBD believes that there is an opportunity to do even more to control costs for the plan. We will be asking our hospital partners to look closely at pricing, and we ask state plan members that you look at any care you might have outside the state, and if it's appropriate, consider keeping it with our in-state partners. HCBD will continue its efforts to control costs and manage the state plan, continuing to work with Montana hospitals and other partners to address the rising costs of health care on behalf of the state plan members and the taxpayers of the state. Employee, legislator, and employer contributions will remain the same for 2020. HCBD is pleased to be able to make this announcement and would like to highlight that this is the 4th year that the state plan has been able to pass on a $0 increase to the state of Montana and its employees and legislators. This is unheard of in the health insurance market, and it's a testament to the work that the HCBD team does in order to control the costs and savings. This slide reflects the medical, dental, and vision hardware rates for 2020. Again, there are no changes to the rates for 2020. This slide reflects the administration fee, the contribution amounts allowed for flexible spending or FSA, as well as the premiums for life insurance and long-term disability. Again, no change. However, I would like to point out that this year's annual limit that is allowed for medical flexible spending accounts was increased from 2,650 to 2,700. The annual limit for daycare or dependent care flexible spending remains at $5,000 per household. As stated on the previous slide, medical FSA annual contribution limit this year is $2,700 for 2020. You may roll over up to $500 of unused medical flexible spending contributions that remain at the end of the 2019 plan year. These can be used towards expenses incurred in the 2019 plan year. The rollover amount does not require a 2020 medical flexible spending account election. However, you will want to remember that any qualifying expenses incurred in this current plan year must be submitted for reimbursement within 120 days after the end of the plan year, which is April 20th, 2020. The dependent care or daycare limit is $5,000 per household. Some employees get confused regarding the difference between medical flexible savings accounts and dependent care or daycare flexible savings accounts. The dependent care or daycare FSA enables you to pay for out-of-pocket work-related dependent daycare expenses and is not used for medical-related expenses for dependents. Remember, you must re-elect coverage during open enrollment for both flexible spending accounts in order to participate in flexible spending in 2020. There is no debit card fee with ASI, and everyone who makes an active FSA election for a medical FSA plan will receive a debit card. When participants use the debit card to pay for FSA-approved expenses, there are IRS regulations that require the participant to provide supporting documentation to show the actual date of service, patient name, and description of the service. This is not a new requirement with ASI, and it is an IRS requirement. Employee rates are outlined in the Employee Open Enrollment booklet on page 4, and again, those were mailed to employees the week of October 14th. And they've been posted on the HCBD website at www.benefits.mt.gov. We are also pleased to announce that there'll be no change to the medical plan out-of-pocket costs. That means medical plan copays, deductibles, and maximum out-of-pocket costs will stay the same for 2020. You can refer to the open enrollment booklet, the HCBD website, or the WRAP plan document for additional state plan coverage information. Please remember that the state plan members may not use the state plan, including the Montana Health Center, for any work-related injury or illness. If you or anyone covered on the state plan, including dependents, gets hurt or sick while working, the state plan will not provide coverage even if you have a work comp waiver. Make sure you and your covered dependents have proper insurance coverage in place to cover work-related injuries. If you are considering retirement, you have the option to stay on the state plan if you're eligible. However, there may be lower cost alternatives outside the state plan coverage, and we do encourage you to review all of your options. One of the alternatives for non-Medicare retirees, those under age 65, is the health insurance marketplace at www.healthcare.gov. For Medicare retirees over the age 65 and older, Medicare supplements might be a lower cost alternative. For more information on these alternatives, employees can contact a state health insurance program or SHIP representative in their area by calling 800-551-3191 or the Agency on Aging, which is the Rocky Mountain Development Council, at 406-457-7368. If at separation from service you are not eligible to receive a retirement benefit under the applicable retirement system provisions, you are then eligible for 18 months of COBRA coverage. COBRA coverage is required by federal law, and it provides you the opportunity for the employee and their covered dependents to continue group health insurance coverage due to a qualifying event, such as terminating your employment or losing plan coverage eligibility. COBRA is also an alternative option to the state plan retiree benefits for those eligible to receive a retirement benefit. But keep in mind there's a cost difference between retiree benefits and COBRA. Rates are available to review at www.benefits.mt.gov. But the biggest difference is the period of time that you may remain covered. Lifetime for state plan retiree benefits versus 18 months of COBRA. If you retire and decide to continue on the state plan as a retiree, you and/or any dependents that are Medicare eligible must enroll in Parts A and B, and you will be automatically enrolled in the state plan Part D prescription drug coverage. You cannot, however, sign up for any other Part D coverage because if you do, you will not be allowed to stay on state plan benefits. This year's Live Life Well incentive deadline is October 31st, 2019. Don't miss out. Hopefully you've already had a state-sponsored health screening, and we have sent many reminders. Employees must complete all 3 requirements to earn any of the incentive. We have added extra screening opportunities at the Montana Health Center locations for October, but we cannot guarantee members can get in if you have waited. Incentives earned in 2019 will be applied to the 2020 state plan year contributions. Please visit the benefits website at benefits.mt.gov/incentive for complete instructions and much more detail regarding the incentive. Remember, participation in a state-sponsored health screening will automatically be reported on the MyActiveHealth website, but it takes about 1 month from the date of your screening to show up on this website. To earn your incentive, you do have to self-report your nicotine status or alternate activity and your next step activity on the MyActiveHealth site. Even if you did a wellness challenge such as the Governor's Stay Active Challenge, you must still report your completion of the activity on the MyActiveHealth site in order to earn all of the incentive. If you are not nicotine-free, but you did an alternative like a nicotine cessation program, you have to self-report that as well. You should self-report your nicotine status and the next step activity as soon as they're completed. You do not need to wait for your health screening activity to show. Remember, additional instructions are available on our website at www.benefits.mt.gov/incentive. And if you're then ready to self-report your activities, you will visit the myactivehealth.com/SOM website. We recommend you review the information on the benefits.mt.gov website prior to reporting your nicotine and next step activities. If there's any medical reason that you can't do some of the parts of the Live Life Well incentive, there are exceptions and alternatives available. We encourage you to call Healthcare and Benefits Division to learn more, or email us at benefitsquestions@mt.gov. The 2020 Live Life Well incentive program will be the same. However, HCBD will be asking participants to participate in a next step activity that is focused on their own specific risks. The 2020 Live Life Well program restarts on November 1st, 2019, and all 3 incentive activities must be completed by October 31st of 2020. Remember, that's a state-sponsored health screening and self-reporting that you're nicotine-free or have completed an alternative, and have completed and self-reported a qualified next step activity. This year's open enrollment period runs from October 27th to November 9th. All state plan members, employees, legislators, retirees must complete open enrollment elections online or via a mobile device. The open enrollment booklet contains important information that you need to know in order to complete your benefit elections. And the booklet was mailed the week of October 14th, which is also available on the HCBD website. The open enrollment system will be open starting October 7th, and all open enrollment elections must be completed by November 9th. You will access the open enrollment system via the HCBD website at www.benefits.mt.gov. If you access the enrollment system via the State of Montana network, you will not be required to register for an account, and you will be able to access the system using a single sign-on, or SSO. Additional information will be provided in the coming slides. During open enrollment period, you can make changes to your coverage like enrolling in or waiving the state plan. You can change your life and long-term disability elections. You can also add or delete dependents from the plan. And if you want to elect or re-elect the Vision Hardware plan, you must enroll or re-enroll in flexible spending accounts. You must complete open enrollment. If you do not complete your open enrollment election, you will have the same medical, dental, life insurance, and long-term disability coverage you currently have in 2019 for the entire 2020 plan year, unless in the future you qualify for a special enrollment period. If you do nothing, the enrollment in medical and dependent care flexible spending accounts and the Vision Hardware plan will terminate January 1st, 2020. Medical FSA accounts with less than $500 at the end of 2019 will roll over into the 2020 benefit year. But as a reminder, FSA claims can be submitted for the 2019 plan year through April 30th of 2020. Remember, you must re-elect flexible spending accounts and the Vision Hardware plan every year. The open enrollment period is also a time that employees can elect to be joint core. If you or your spouse or domestic partner work for the state and are eligible for benefits and have a dependent child or children covered on the state plan, you should be joint core. Being joint core means that you have one shared family maximum out of pocket, and the rate is better than being employee, child, and children, and employee only. For more information, contact HCBD. If you do not wish to make any changes to your current coverage, or you do not wish to enroll or re-enroll in flexible spending accounts, or elect or re-elect the Vision Hardware Plan, then you do not need to do anything during open enrollment, and you do not need to complete anything online. Remember, if you don't complete the 2020 open enrollment election process, you'll have the same medical, dental, life, and long-term disability coverage for yourself, your spouse or domestic partner, and or dependents in 2020 as you had in 2019. You will not be enrolled in flexible spending accounts or the Vision Hardware Plan unless you complete an open enrollment election. So contact Healthcare and Benefits Division at 800-287-8266 or via email at benefitsquestions@mt.gov if you have any further questions. Remember, all open enrollment elections are due November 9th. To begin open enrollment, you first need to access our website at www.benefits.mt.gov. You will select a red button titled Click Here to start open enrollment. However, this red button will only be visible during open enrollment. Some employees are unable to use the single sign-on feature due to firewalls and other agency restrictions. If you click on the red Open Enrollment button and are then prompted for your username and password again, you will need to re-enter this initial computer login username and password in order to continue. Once you are logged into open enrollment, you will select Start Here. Then you will follow instructions to complete your open enrollment elections. Remember, you must complete open enrollment elections by November 9th, and the system will show you the number of days remaining to complete your enrollment. Like last year, you will be taken to a page to verify your personal information, a dependent page where even life insurance designees must be listed, and then through each benefit offered. At the top of each page is a blue box. This box contains important information for that page and benefit. Please read this information. Much time has been spent to assure that the instructions are helpful and understandable. As you navigate each benefit, there will be a box to the left of the screen that will track each benefit elected and any required contribution associated with that election. This is a great way to assure that every benefit has been reviewed and nothing has been missed. Please note that the contribution costs displayed are bi-weekly costs. Important, your vision elections. There will be no appeals approved this year if you fail to enroll or re-enroll in the Vision Hardware benefit. On the Vision page, there are two Vision plan options available: Basic Vision Exam only, or the Vision Hardware plan, which includes the Basic Vision. So you must elect by either selecting Basic Vision Plan only or the Vision Hardware plan by pressing the Select button next to the election that you want. If you want Vision Hardware, you will scroll down and select the Vision Hardware plan. And by selecting the Vision Hardware plan, you will get both Basic Vision and Vision Hardware plan for yourself and any covered dependents enrolled on your medical plan. Remember, the box on the left-hand side of your screen will track your benefit elections. And if you intended to enroll in Vision Hardware coverage, there will be a cost associated for that coverage. If no cost is listed, you will only have elected the Basic Vision, and you will not be enrolled in the Vision Hardware coverage for 2020. Once all your elections have been made, you will be prompted to confirm your elections and then agree to the amount billed. The amount shown will be the bi-weekly paycheck amount that will be withheld. Once you complete, You will be taken to the confirmation page and can print a copy of your elections by clicking the Print Benefits Summary button at the top right corner of your screen. We highly recommend you print a copy. Remember, there'll be no appeals on the Vision hardware benefit this year. You also have the option to download the My Choice mobile app on your mobile device or tablet, and you can complete your open enrollment elections on a device. The app is easy to download, install, and is available for use all year long for any updates and changes you may have. This is also a great way to keep your address up to date so you don't miss out on any mailings. To access the app, first you start on the HCBD website on your computer and click the red bar to start open enrollment. If you've not already established a sign-on, you must do that first to get logged into the system. But once you're in the system, you will click on Get Access Code on the right-hand side of your screen. That will prompt you to then choose your phone operating system and enter your mobile phone number. Then on your mobile device or tablet, you will receive a text with a link to download the app. Once the app is downloaded, it will require you to enter the access code that was listed on Step 2 from the website to sync up the information and complete the enrollment using your mobile app. You will receive an email when your 2020 benefit summary has been finalized. After you make your elections for 2020, you can always access this summary at any time by logging into the enrollment system and clicking on Benefit Summary. Watch for the email notification and then go online to verify that we have you enrolled correctly for 2020. During and after open enrollment, other important documents will be coming to you from HCBD, including the 2019-2020 WRAP Plan document, or WPD, and this outlines everything covered and all state plan details. You'll also receive a summary of benefits coverage that's a legal document required by the Affordable Health Care Act and is a short summary of our plan. Medicare Part D creditable coverage letters have already been mailed out, and there are a few other legal notices. This year, the Department of Justice has asked us to include this slide just as a reminder that Real ID is due to be completed by October 1st, 2020. Any questions you have on Real ID should be found at their website at www.mtrealid.gov. Looking for more information on your benefits? Please feel free to contact Healthcare and Benefits Division staff with any questions or concerns at 800-287-8266 or emailing benefitsquestions@mt.gov. Thank you.